Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Roshni. Let's look at today's top headlines. Delhi reports 1,797 COVID-19 cases along with one death. Delhi reported 1,797 new coronavirus cases today, a 35% rise since yesterday's figures, amid an upward trend in infections across the country. Besides, one virus-related death was also recorded that increased the death count in the city to 26,000. The positivity rate in the city stood at 8.18%, and this is the fourth consecutive day Delhi's daily figure remained above 1,000 mark. With 901 recoveries logged in the past 24 hours, the city now has 4,843 active cases. National Board Examination reduces NEET SS 2021 cutoff by 15th percentile for 32 specialties. Complying with the order of the Union Health Ministry, the National Board Examinations has reduced the cutoff for the NEET Super Speciality examination by 15th percentile and published the revised cutoff scores for admission to DM-MCH courses. The notice read that in compliance with Ministry of Health and Family Welfare, the minimum qualifying criteria of NEET SS 2021 has been reduced by 15th percentile. Ames reveals right way of eating momos. Earlier, people used to eat momos while walking in the hills, but now momos is available in almost all cities, and especially Delhiites are really much fond of momos. There are different kinds of momo everywhere, but no matter how small the size of the momo, it must be eaten very carefully. Such a warning was issued by the All India Institute of Medical Science in Delhi. A research paper on eating momo by Ames has been published in a journal called Forensic Imaging. There is mention of the death of a middle-aged man because of momos. It got stuck in his throat and he died. During the autopsy, it was found that momo tea was stuck in the mouth of his trachea. After that, the doctors came to the conclusion that momo was trapped and died. As a result, Ames advises people to be careful while eating momos. 300 medicines have been finalized for QR code. Amending the Drug Rules 1945 through a recent Gazette notification, the Ministry of Health and Family Welfare has issued a draft of a certain rule specifying 300 medicines which would be required to embed unique quick response codes on their packages in order to enable authentication more efficient. In accordance with the draft rule, the manufacturers of drug formulation products as specified in Schedule H2 of the Drug Rules shall print or affix barcode or quick response code on their primary packaging label, or in the case of inadequate space on the primary package label, or on the second package label that stores data or information legible with software application to facilitate authentication. This move came in order to guarantee authenticity and enable tracking of medicines. These are the tablets which are among the brands on the list which would be required to embed the QR codes on their packages in order to guarantee authenticity and enable tracking. India's largest private hospital in Faridabad to be opened very soon. The first phase of the 2,400-bedded Amrita hospitals in Faridabad, a jumbo facility spread across 133 acres of land and being touted as India's largest private hospital, is set to get operational this August with 500 beds. With a total built-up area of 1 crore square feet, the mammoth facility has been undergoing construction since 2016. This is the second largest scale Amrita hospital in Delhi after the 1,200-bed center in Kochi, Kerala. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.